Guys, so in today's video I'm going to be talking about dealing with rude doctors and physicians or PAs or nurse practitioners or anyone who is above you in writing orders for your patients. Recently I have encountered a few situations where I have had doctors be extremely rude to me, and without getting into too many details, I'll kind of just broadly tell you. One physician told me not to call him back unless it was a real issue, and it was a real issue what I was calling him about. And then another situation, I had a doctor hang up on me twice mid-sentence, and it wasn't a disconnect or accidental, it was intentional. And so, most of the time doctors are wonderful, and they're great at being very respectful to nurses and trusting their judgment and opinions, and when you call, they understand you're calling for a reason. But there are some doctors who are just downright rude and disrespectful, and so that's what I'm going to talk about today in today's video. So first off, if a physician or doctor is being rude to you, you don't have to take that, if that makes sense. Like, you don't deserve to be talked to that way. And so the first thing is, if you have a physician who is bullying you or being rude or is compromising the care of your patients, then talk to your charge nurse, talk to your house supervisor, and there should be a reporting form for the physician that you can talk about the situation and what happened, and what went on and what was compromised as far as the patient's care goes and all that. And so I recommend filling that form out if you come in contact with a rude physician, because you deserve to be treated respectfully, and the only way that you are going to be, and the only way things are going to get done or dealt with is it by you reporting it. If you don't report it, then no one knows about it. The next thing is, if you're dealing with a rude physician or a physician who's been, disrespectful to you in the past, don't let that deter your ways, or so to speak, of calling them. Like, don't let them scare you away from calling them, because that could compromise the safety and care of your patient as well. So I know it stinks when a physician's just going to be rude to you when you call, but you do your job and you call when you need to call, and you document, you chart, what you called about and what was done about it. We always hear the term in nursing, CYA, or cover your ass, because it's true, and it's sad that it comes to this, but if you notify a physician about something and they decide that nothing is done, they don't want to do anything about it, then you need to document that, because in court, if you end up going to court one day, you can prove that you did your job, you contacted them. In the end, it's going to fall back on them, not on you. Another tip with dealing with physicians who are rude is, you just got to be firm. You don't have to be rude back, kill them with kindness, be respectful back. The last thing you want to do is be nasty back to them, but be firm. If you're calling the physician, have the facts ready. Have every single piece of information that they could ask you, or have your computer next to you so you can look it up quickly if there's something that you don't know off the top of your head. But a very good place to start is, recent vital signs, or, a little synopsis of what is going on. We talk about SBAR in nursing school, and that is very true. You will use SBAR when you are calling physicians or talking with physicians. You just aren't thinking, SBAR, situation, background, you get used to that whole format without actually thinking about it. But in the end, guys, nurses don't deserve to be disrespected by physicians, and vice versa. Nurses shouldn't disrespect physicians as well. And so if you are dealing with someone who's bullying you or putting you down, then it needs to be talked about. It needs to be brought up the chain of command, and don't let that compromise the care for your patients. If you have to go up to someone that's higher than them, then do it. Even those physicians have bosses. So I hope that kind of helps you guys out. This is just a subject that's been weighing on my mind recently, because I've dealt with some physicians who have been nasty to me, and it's not nice. And words do hurt, but I try not to take it personally, and you shouldn't too, because we all have bad days, and we all aren't at our best every single day. But anyways, thank you guys for watching this video. If you have any other tips or any other experiences that you maybe have dealt with, leave those in the comments below. Give this video a thumbs up and subscribe to my channel, and I'll see you guys next time.